If you have ever come across the phrase "stop PMSing," then you are not alone. Watch the video till the end in order to understand the various aspects of PMS, premenstrual syndrome, because only when you're aware of it can you learn to handle it properly. Premenstrual syndrome or PMS is a wide range of physical and psychological symptoms that occurs before periods in many women. It has about 100 signs and symptoms. These signs and symptoms are cyclical, that is, they appear around 8 to 10 days before the periods and often resolve with the onset of periods. Today we are going to talk about some of the very important signs that will help you to diagnose PMS. You may experience some or all of the physical manifestations such as breast tenderness, pain on touching the breasts, bloating, lethargy, fatigue, restlessness, weight gain that is due to water retention, swelling of extremities such as hands and feet, as well as pain in the joints, muscles and back. Psychological symptoms include some or all of the following: anxiety, tension, mood swings, sudden sadness, tearfulness, increased sensitivity of rejection. In moderate to severe cases, you can have all of the above symptoms plus irritability, anger, depression, confusion, sleep disturbances and social withdrawal. Mild form of PMS usually does not affect the quality of life and is diagnosed by the woman herself. You may have the same set of symptoms before each period. Another important form of PMS is called premenstrual exacerbation. In this, there is cyclical worsening of a pre-existing medical, psychological, or physical condition, such as depression, asthma, or migraine, or even epilepsy. These symptoms may or may not resolve by the end of periods. Severe form of PMS is called PMDD, premenstrual dysphoric disorder. This disorder has many severe signs and symptoms of PMS, including the mild symptoms as well. It affects a woman deeply, both physically and psychologically, and it disrupts her daily lifestyle. It affects her job, her relationships, and everything. The Royal College of Obstetrics and Gynecology, the RCOG, recommends daily record of severity of symptoms in case of PMDD. This is a very important tool in which you yourself will mark the severity of each and every symptom you're having for 2 months, that is for 2 cycles, and then contact your gynecologist who will assess it and mark the severity. Since this condition needs special attention and even medication to control it, I will be discussing this topic in another video. Women suffer from PMS without even knowing. 4 out of 10 women experience the signs and symptoms of PMS, of which 5 to 8% of the women may experience severe symptoms. So why do some women have severe PMS while others don't? There are many causes. It is age dependent. Women who are nearing menopause tend to have more hormonal fluctuations and increased severity of PMS. Micronutrient deficiency such as vitamin D and magnesium are linked to the severity of PMS. Certain traumatic events in the past, stress and high body mass index is also linked to severe PMS. Some women are in general more responsive to changing hormone levels in the body, especially of progesterone. So, by definition, PMS has a symptom-free interval in between the menstrual cycle. If there is no symptom-free interval, it may be some other organic, physical or psychological condition that needs to be checked. If you're having excessive pain in your lower abdomen during menses or just before menses, It may not be PMS. It may be some other disease such as endometriosis. So you need to get your symptoms checked before coming to a conclusion that you may have PMS. In the next video, I will be talking in detail about the management of PMS.